So welcome to the Breast Cancer Rehabilitation and Wellness Summit. My name is Denise and I'm the host for this summit. Today it's interesting, I'm traveling and so I'm in Townsville and Carolyn is actually in my home city. So welcome, Carolyn.
Thank you very much, Denise.
So Carolyn Jones is a physiotherapist and she has worked in the field of oncology in the UK. And what I loved when I caught up with Carolyn was that she said that she's been a viewer of the summit and just knew that she had to contribute. So I really appreciate that. Thanks, Carolyn.
No, thank you. And I feel very honoured and excited to be actually part of it this year. So as you said, long-time viewer, first-time caller.
Nice. So Carolyn, what you're going to do is you're going to give us an overview of the importance of exercise.
Yeah, no, absolutely. So benefits of exercise for both breast cancer, both patients and survivors, and then also try and hone in on which exercises are going to target all the different specific side effects that come with breast cancer treatment.
Fabulous. All right, then, well, I'm going to hand over to you, Carolyn.
So a little bit about me. As Denise mentioned, I'm a physiotherapist. I'm Australian trained, but I've done most of my experience over in the UK. I've only recently moved back to Australia, to Brisbane. So all my experience has been in a hospital setting. And then over the last few years, I've sort of specialised in oncology, palliative care, cancer rehab, and then specifically I have a passion for breast cancer rehabilitation. So I've also worked as a lymphedema therapist as part of my physio work. And then I went on to get my personal training qualifications. And the reason that I did this was because I found that patients who were so keen when they finished treatment, they were keen to get back to the gym. And they'd been to the gym previously, but they found it difficult to find a trainer who would work with them and who would take them on. And I know more recently there's been more of a push to educate trainers, which I think is fantastic. And there are cancer rehab courses that trainers can do. But I think there is still a little bit of a gap once patients finish at a hospital and head back into their everyday life at home, and who can look after them in the community. So I think a massive statistics, which is quite scary, is that 70% of our patients struggle with physical side effects, and those side effects can last between 1 to 10 years following treatment. So once they've finished treatment, once they've left the hospital system, they're still struggling with these side effects down the track. So the main goal of today's discussion was how to use exercise as a treatment for all these side effects that are caused by the breast cancer treatment, but then also which exercise is going to be most beneficial for each of these side effects. So if we talk about exercise in general, and in the literature, it's also known as physical activity. So it doesn't have to be anything too formal or scary. It doesn't necessarily require Lycra. It can be anything as simple as getting out in the garden or even taking your dog for a walk. So physical activity, it's also recently been called the underrated wonder drug, which I think is quite nice. And while we know with breast cancer, we have the three main treatments, which is surgery, chemotherapy, and radiotherapy. So physical activity or exercise is starting to be known as the fourth treatment, which I think is great. And people always often, they wonder whether exercise is safe, but we know that the American College of Sports Medicine has said that it's safe for both during and after most types of treatment for all cancer. But then most specifically, I think survivors should avoid inactivity, which I think is quite important. And I think what's also important is that we start planting this seed of exercise right on diagnosis so that patients are getting used to being active, and it's being really encouraged throughout their whole treatment process, and then when they come out the other end as well. So I thought we'd just look at some of the exercise guidelines, so you know what I'm going to be talking about as I go through it. The exercise guidelines for cancer survivors are pretty much the same as any other population group. So whether that's general population or also patients, sort of cardiac patients or diabetic patients. So 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Okay, and this can be a combination of cardio or aerobic exercise, so something that gets you out of puff, resistance exercise, which helps with strengthening, and then also flexibility training. And we advise that it's best to start in small doses especially if you're someone that's not used to exercise, and then build up gradually. And you can actually break down that 150 minutes into more smaller manageable loads. So if you look at 30 minutes, 5 days a week is your 150 minutes, but you can break that down even into 3 blocks of 10 minutes, which some patients find it is much easier to do. So just a quick little safety announcement. I'll get my airline hostess badge on. It's important that patients are encouraged to seek guidance or even supervision if that's necessary. So try and find either a qualified health professional or a personal trainer, but someone that's dealt with cancer patients or survivors before. Because actually, if you're in the wrong hands, exercise can do more harm than good. So if you're a patient, or a client, or a survivor, try and find someone who's qualified and be prepared to ask them questions, and that they may ask you to get medical clearance before starting. And this is actually a good thing that they're taking that responsibility. But on the flip side, I'd also be really worried if your trainer didn't ask any questions, if they just kind of took you on, didn't really have any questions about your treatment history, because that's quite scary as well. And then if you are a trainer or a health professional, make sure you get a nice thorough medical history, but then also a specific treatment history about any surgery, radiotherapy, chemotherapy, any complications. I always try and get a letter from the consultant, the oncologist, asking if any restrictions or any concerns that should be considered with exercise. Okay, so if we look at exercise, I guess the most common benefit of exercise, and one that we all hear about, is weight loss. And also I think what we forget is just maintaining healthy weight. And so if we, I'm going to mention a term called body mass index here, which is commonly known as the BMI. This is a measurement of someone's height versus their weight, and it gives a number usually between sort of 15 and it can go up upwards of 40. So it puts people into brackets whether they're underweight, healthy weight range, overweight, obese, or morbidly obese. Just keep in mind when this is mentioned, it sometimes isn't the most accurate measurement because it doesn't take into account someone's body composition. So you can have 2 people who are the same height, same weight, but one might be quite fit and muscular, and the other person actually sort of has more fatty tissue. They're going to have the same BMI, but one of them, the more muscular one, is obviously in a slightly healthier range. So just be aware of that. But it is the most common measure of weight in the medical industry. So the reason I mention this is that an increased BMI, there is a direct link with an increased risk of breast cancer, and this is especially common in postmenopausal women. And the reason for this is that overweight or obese population, they actually have a higher level of estrogen. And we know that estrogen is the driver behind some forms of breast cancer. So your ER-positive breast cancers, estrogen receptor positives. The reason why some patients do put on weight through their breast cancer treatment journey is a number of reasons. So medication is a big one. So especially steroids, patients that are on prolonged use of steroids, they get this fluid retention, almost this puffiness around their face, but also steroids increase appetite. So they find that they're snacking and eating a lot more. I mentioned fluid retention, so not even steroid induced fluid retention, just holding on to water. And then also decreased calorie expenditure. So people aren't burning off as many calories as they would have done previously. And this can be just through inactivity. They're spending a lot more time in hospital, whether it's even just sitting in a radiotherapy waiting room or in a chemotherapy unit chair. They're not up and about as much as they would have done otherwise. So when we look at weight loss or trying to maintain weight, the types of exercise that are going to be beneficial is actually a combination of all of them. And it's really, this one's down to personal preference, but I find the best mix is a combination of cardio, resistance, and also flexibility. But the key thing to remember with weight loss is even probably more important than exercise is nutrition. So a lot of the other side effects that I'll mention today, nutrition doesn't play as important a part, but it definitely does with weight loss. So probably the most common side effect with breast cancer treatment is lymphedema. So I'll give you a very quick lesson on what lymphedema is in sort of, 30 seconds. So lymphedema is the buildup of this protein-rich lymphatic fluid, and it's caused by the body's inability to drain from the arm. We see it in the arm in breast cancer. So the body's not able to drain it from the arm back into the rest of the lymphatic system. So in breast cancer, this happens most commonly if the lymph nodes have been removed from the axilla. So this interferes with the body's transport system, and you end up with that build-up of swelling in the arm. So we know that exercise has actually been shown to be beneficial not just in the treatment of lymphedema, but also in the prevention of lymphedema. And this is something that we need to really drum home with patients. So the way that the exercise helps is that it uses the mechanism of a muscle pump. So if I'm moving my arms in this exercise, it's a sort of the biceps that are working. They're helping to pump and help facilitate that lymphatic drainage, so drawing that fluid back up into the rest of the system. So this is why resistance training should be the most important part of a patient with lymphedema, part of their exercise program. Okay, so the other consideration, we know that if you have a limb with more fatty tissue, it places higher load on the system, and we know that this is why patients who are overweight have a higher risk of developing lymphedema. So if you are someone with lymphedema or a patient who's been identified as being high risk for developing lymphedema, we want you exercising, we want you using that arm, but we also want you wearing a properly fitted compression garment. So whether it's been given to you by a lymphedema therapist or a physiotherapist, and that's also going to help that muscle pump. The compression helps the squeeze, okay, to move that fluid back up into the system. So while we want you moving your arm, we want you to avoid repetitive overuse of that arm. So I know that sounds tricky. We want you moving it, but we don't want you moving it too much. But it's really sort of avoiding anything going too over the top. So I once had a patient who went on a kayaking trip for the weekend. So she was kayaking 8 hours a day over 3 days, and she came back and unfortunately developed lymphedema. So it was just that repetitive kayaking motion was just too much for her poor arm. And then, like everyone, we want you practicing good limb care, looking after your arm, trying to avoid any infection, and following your do's and don'ts, which hopefully you've all been educated about after surgery. Okay, so slightly similar to lymphedema is your non-lymphatic fluid retention. So that's the puffiness that you can get in your hands and feet, and that can be caused by the body retaining salt and water. So it's not lymphatic fluid, but just the body holding on to that water, and that can be due to medication, various medications, or also heart or liver or kidneys just not functioning as well as they need to be. So you're more likely to be under the care of your medical team for these reasons. And also nutrition can sometimes play a part in that. So with exercise, though, it's the same principle as lymphedema. We want you exercising, trying to keep that muscle pump moving, and it also helps improving circulation to help return that fluid. So if we move on to shoulder rehab, which is an area that us physios are especially passionate about, because it's the reason I think that we see most of our patients. So our goal here is to try and regain full shoulder movement, or as close to full as possible. So I'm not sure, you probably can't see too well, but the movements that we work with, so flexion, so moving the arm in this direction, and then abduction out to the side, and then also internal rotation, so this movement of sort of moving around that way with different angles. And I always say that movement always seems to get forgotten, but I say it's so important for activities like trying to do up a bra strap or pulling up trousers. I say trying to put your hand in your back jeans pocket. So they're the movements that we focus on specifically. So when you think of surgery, especially a mastectomy, a radical mastectomy, so where you sort of remove a structure like the breast from the front, the chest wall, you completely change the anatomy of the whole shoulder complex. So, and you're going to get asymmetry in the body. This can cause posture changes, so compensatory patterns. If you're sort of tied across the front with scar tissue, it can pull your shoulder forward, and that then completely changes the movement patterns in the rotator cuff and the shoulder complex. And then also, as I mentioned before, inactivity. So if you're spending time in waiting rooms and treatment chairs, so usually they're not designed with posture in mind. And so this is when sort of a lot of patients I find get neck tightness, shoulder stiffness. So we really sort of want to try and educate to try and prevent these changes before. It's much easier to prevent them than try and treat them later down the track. Other things that can change, so with your anatomy, is scar tissue and scarring can change sort of the skin integrity. And then also, I know a lot of people know about cording, or also known as axillary web syndrome. And that's those tight guitar strings that can occur in the axilla, and then also can spread all the way down the arm and even into the wrist in some cases. So I will say it's imperative that you regain your full shoulder movement before starting any resistance training. So before doing any strength, before adding any weights in, try and get as close to full shoulder movement as you can. The reason for this is because when you add load onto an arm that has poor muscle patterning, you can actually cause further musculoskeletal problems. And that's, as I mentioned before, you can start getting neck pain, start getting problems in the other shoulder. So I really recommend activities like yoga, Pilates. I know different places run stretch and relaxation classes. So we're trying to sort of lengthen out the muscles, get the shoulder moving nicely. And then down the track, things like dragon boat racing, stand-up paddleboarding, tennis, they're all going to be absolutely brilliant for strengthening up the shoulder and keeping it nice and mobile. So now I'm going to mention peripheral neuropathy, which is the numbness and pins and needles in the hands, fingers, feet. And we know this is due to the damage to the nerves caused by chemotherapy agents. So unfortunately, the problem with peripheral neuropathy is the recovery is so slow. So the nerves can take up to 2 years to repair themselves. So some symptoms can be permanent, unfortunately. So you might not ever get full resolution of symptoms, but they will continue to repair, and slowly, if you imagine how slowly hair grows, that's even faster than what nerves grow. So there's the numbness, the pins and needles. It can affect your fine motor skills, so things like doing up buttons, even writing. That's what patients report they find difficulties with. So these are exactly what we want you to practice to the exercises to try and improve the symptoms of the peripheral neuropathy. So anything that's going to stimulate the nerve endings, so even sort of rubbing fingers together, lots of hand and finger exercises, finger tapping, this is what helps to improve the symptoms. If it's a peripheral neuropathy that's affecting your lower limbs, so that's when you find your balance is more affected. And things like tripping over things. So we want you to be careful with anything that you're doing with your balance, and things like Tai Chi and yoga, they're what help the symptoms. But also try and remember to consider having correct footwear, check for blisters, cuts, scratches, try and avoid extreme temperatures, extreme cold, remember to wear proper socks and gloves, because that, if you can imagine that when sort of you've got this numbness, you can't quite feel the temperatures and the sensations as you would have done previously. So moving on then to cardiovascular health. So the what you know is like your CV fitness, cardiovascular fitness. So we know that chemotherapy toxicity causes damage to your heart muscle. So luckily with neuroradiotherapy techniques, it is more unlikely that you'll develop any side effects to the heart and the lung tissue. But there is still a risk of blood clots and DVTs, deep vein thrombosis. So that's another reason to stay active and mobile, because we know that patients who are immobile and who don't do much activity, they're more at risk of blood clots. So, but the most common effect on the cardiovascular system is just poor endurance and deconditioning. So from just decreased activity that you've had during treatment. You haven't been as active. You've had days where you've been feeling unwell, even having to have hospital admissions if necessary. So you've lost some of the fitness. So the best forms of exercise to improve your cardiovascular fitness is anything aerobic. So that's anything that gets you out of breath. So walking, jogging, swimming, cycling, the world's your oyster, absolutely anything. So I know some patients ask about heart rate ranges when they exercise, and if you've ever used sort of an equipment at a gym, so whether it's an exercise bike or a treadmill, some of them have different target heart rate zones. So there's the fat burning zone, and then if you go up higher, there's sort of a cardiovascular training zone. So it's fine as a cancer patient or a survivor, it's fine to try and work in these zones, but just keep in mind that your desired heart rate may be reached a lot sooner than previously, just because you're a little bit deconditioned. So the heart's having to work harder at a more minimal effort than before. But if you are worried, I know some patients do like to keep an eye on this, so you can monitor your heart rate just with one of those fitness watches, so sort of Garmin, Apple Watch, Fitbit. But just be aware that anything that's on the wrist that measures it can be slightly inaccurate depending on the activity. So you do get increased accuracy just with wearing a chest strap for the heart rate. And now decreased bone density. So that's looking at the integrity and the stability of the bones. So most people will have heard of osteoporosis, but maybe not heard of osteopenia, which is the precursor to osteoporosis. So where the bone is starting to thin slightly, but it's not as brittle as osteoporosis. So patients who have developed osteoporosis or osteopenia, they're at an increased risk of bone fractures. So when thinking about exercise, they need to avoid anything high impact. So unfortunately, no kickboxing or rugby, but then also need to look at any activity where there's a high falls risk, so horse riding or cycling if you're not a confident cyclist. So the way that osteoporosis is linked to breast cancer treatment is the use of drugs such as tamoxifen and other aromatase inhibitors such as Arimidex. So patients can be on these drugs for 5 years after treatment's finished, and that's what affects the bone density. So patients, if they're at risk or they've been diagnosed as having osteopenia, they're usually put on a bisphosphonate as well. So they're drugs like Zometa, Fosamax, there are a couple of others as well. And then when it comes to exercise, our goal is obviously to stimulate bone strengthening. So the most effective form of exercise for this is anything weight bearing. So walking, jogging, even doing body weight leg strengthening like lunges, squats. That's resistance training as well, because you're using your body weight as a weight. So as much as I love swimming and cycling, it's not going to be beneficial for bone density, but obviously has other benefits as well. So then I'll just quickly touch on some of the other added benefits that come with exercise. So they're not all physical. There's the concept of empowerment and control. I know that's after sometimes patients go through years of treatment, they've had no control over their regime and its effects. It's great that they can be in charge and to be able to see some physical progress because of something that they've done. And I think that's so important psychologically. And then I'll also mention just the aesthetic benefit of exercise. One of the cruelest effects of treatment is losing a breast or, sometimes both breasts. And then with chemotherapy, there's hair loss. And hair and breasts are such key symbols of femininity. And I think exercise helps you to not only feel good, but also look good by trying to improve body composition, no matter how hard it can be. And then also there's the well-known benefit of exercise on your mood. So it improves mood. So we have endorphins, or indolphins, as I sometimes hear patients call them. So endorphins are a hormone that's secreted by the brain. And this happens during exercise. And it's undeniable that once you do finish going for a walk or going for a run or going for a swim, you do feel much better afterwards and, just a bit of a spring in your step. So I'll just touch on fatigue and sleep just very quickly, because I do know that Lou James is covering fatigue management in another session on the summit. So historically, cancer patients were told to always put their feet up, and even doctors advised patients that the way to treat fatigue was to rest. And while I agree that rest is important, we now know that physical activity doesn't actually increase fatigue, but in fact it decreases it and it improves energy levels. So don't ever get away with saying, oh, I'm too tired to go out and exercise. And you've also got the added benefit of improved sleep. So when you do exercise, you get much better quality of sleep and it is easier to fall asleep. And it's so common that poor sleep can affect your mood and can contribute to depression. So exercise can help with that as well. So I also saved the most important benefit until last. So research has shown that breast cancer survivors who are physically active have a decreased risk of recurrence by approximately 24%, which I think is huge. And if you take one thing home from my discussion today, I think that would be the one I'd want you to take home. So if you're active and try and meet your exercise goals, you're decreasing your risk of your disease coming back by almost a quarter. But not only that, if unfortunately you do have disease recurrence, you can reduce the risk of dying from the disease by 30 to 40% if you reach your weekly goals compared to those who do less than an hour per week. So remember I said before that our goals are 150 minutes per week, so 2.5 hours, so spread over the week. So if you manage to obtain those goals, then you reduce the risk of dying from breast cancer recurrence by 30 to 40%. Okay, so it's all easier said than done. So how do you put it into action? So I know exercise doesn't come naturally to a lot of people, and especially patients or survivors if they've come out of treatment and they're feeling exhausted, they're deconditioned, they're nowhere near as fit as they used to be. You know, the smallest activity, makes them feel like they need a nap. So I know it can be hard to implement, but the easiest way is just to start small and try and build up gradually. And then start with what we call incidental exercise. So this is those activities that it's not serious formal exercise. It's, doing the grocery shopping and walking around a big supermarket holding onto a trolley, or walking a couple of laps around a shopping centre in the air conditioning where it's nice and cool. So just start with small bits and then gradually build up as you feel your fitness allows. Another thing I tell all my patients is to try and make it social. You're more likely to stick to something if you're having fun. So a great initiative that I try and recommend to everyone is Parkrun. So I don't know if everyone knows about Parkrun, but it's a free 5-kilometre walk or run. It's held every Saturday morning and it's all over the world. I know it started in the UK, but it's all over Australia and I think it's through many, many countries. It welcomes all levels of fitness. And there's always a tail walker at the end, so you're never going to be last, no matter how slow you are. Because I know that's what stops a lot of people from, starting these exercise regimes. They're worried about they'll come last, they'll be embarrassed, they'll be at the back of the pack. So with Parkrun, you never have to worry about that. Other great initiatives, I know there's dragon boat racing. You can join local walking groups, local tennis groups. And I think when you arrange to meet up with other people, you're more likely to go because you're worried about letting other people down. Whereas if it's just yourself that's doing it, then it's just too easy to say, I'll do it tomorrow. So try and plan it. Try and plan your exercise session as if you would an appointment. Write it in the diary. Then it's in ink. It can't be cancelled. You have to go. Like you wouldn't bail on a medical appointment or a dentist appointment. And then once you get into the habit, it becomes much easier to continue. And try and set yourself some goals. I really recommend that people set goals, whether it be to complete a fun run or even just walk to the end of the street without losing their breath, or swimming 10 laps without stopping. Whatever it is, if you've got something to work towards and you can see yourself making progress, it just becomes much easier to stick to those habits. Okay, so that's all from me today. So thank you very much for everyone for listening. Thank you to Denise for letting me present in this year's summit. So as you can probably tell, exercise and physical activity is something that I'm incredibly passionate about. If anyone has any questions, I'd love to chat, and I'm sure we'll pop my email address up. I hope you all enjoy the rest of the summit, and I hope you learn a lot from all of our experienced and amazing speakers. So thank you.